With ERP, it's such a good example. I'm going to run with it. It's not harming the client, but it is creating a level of discomfort for inhibitory learning. And so there's a therapeutic value attached to it.
The main thing that I was thinking about is that discomfort is such an essential part of therapy. I think for the way that I think about therapy and the way that I like do therapy. So using the language of the foundations that I have, which is acceptance commitment therapy or ACT, discomfort is required almost in order to then be able to practice the skills of psychological flexibility. So the idea with ACT and the reason why I love it so much is that the thing that causes the majority of our problems, if we're talking about like diagnosis, is the idea that we get like really rigid and stuck. So getting out of something where we are rigid and stuck is inherently uncomfortable, and it causes us to become more psychologically flexible.
I think like lately I've just been so aware of how people come to us and they want it gone. Get rid of my anxiety, get rid of my depression, get rid of my trauma. And I probably naively bought into the idea with trauma work at some point that I was going to help these people get rid of it. And then after doing work for so long, you realize that's not how this goes. There's a bunch of acceptance that has to go into this. And I love ACT because of this idea that like we are trying to help our clients like feel like they can navigate, and not that they won't have feelings. It's that they're going to have them and they're going to learn to have them and then bounce back. Like that
Mm.
resiliency. I always do the rubber band in my office, it pulls back. Now, what's your pillow that's going to help you push back forward? It doesn't mean we don't suffer. Suffering is a part of this. It's just how do we rebound from it?